And welcome back to our continuing series, Insurance 101. Well, in today's world, many people make the decision to work past the age of 65, and there's many questions that come with that choice, and some of them are a little bit tricky.
That's right, especially when it comes to important issues like medical coverage. So here with help is Luke Stecker. He is the president of Great Lakes Medicare Solutions. Great to see you.
Great to see you both. Thanks for having me on again.
Absolutely. We live in this age where people are working past 65, which it seemed like everybody, like many years ago, retired right at 65, and sort of brings up these important questions about your medical coverage.
Absolutely. So there's tons of tricky questions that come along with deciding if you want to retire and when you should retire. And one of them is if you should join Part A, if you should join Part B, what you should do with your current coverage. So I thought it'd be beneficial to answer some true and false questions to help the viewers make that decision.
Smart. Okay, let's get to it. You can play along with us at home, right? Okay, so the next one is, should you enroll in Medicare at age 65 when you're still working? Do you need both Part A and B, or can you enroll in just one of them?
So great question. I think that's true.
It is true.
So you can enroll in whichever you want. If you want to, continue on your group coverage, you can stay there if it makes sense for, your healthcare needs, your medications, and also taking into consideration if you have a spouse who's on your group coverage or a stepchild or your own child. These are all things to really weigh in on your options.
Okay. So true or false, Part A costs nothing at age 65 for most people.
So that is true. So
Nice.
Part A is likely premium free as long as you've worked for 10 years amounting to 40 quarters paying into Social Security. Those taxes that you've prepaid have given you this Part A for free.
Yeah.
Now, however, your Part B will cost a premium, and that does depend on your income. And the income does look 2 years back. So even if you are 65 and you haven't been working for a year, they're still going to look at that 63-year age mark and see what you were making at that time.
Okay. The next question. Some people eligible for Medicare and employer group health coverage choose to delay enrolling in Medicare Part B and Part D while still covered on their group health coverage.
Awesome. That is also true.
Okay.
So, as you know, people can delay enrolling into Part B or D because typically an employer group or union coverage gives you your medical and your prescription. Whereas, so it's a great thing to look at and really consider, but it really does depend.
Okay.
That makes sense.
Next one, when you retire, leave coverage, you are granted a special election period to enroll in Part B and Part D with no late penalties.
That is also true.
That's a bonus.
Yes, absolutely. So this is kind of my sweet spot when I meet with people and I get to talk to them. I get to look at their current coverage with an employer group plan or a union and really weigh it out and see if it makes sense. So you can absolutely, delay your Part B enrollment, and it does make sense to do that if your employer group or union gives you that medical or prescription coverage.
That's great. All right, the next one. If you have a high deductible health plan and an HSA that goes along with it, you should not enroll in any part of Medicare.
This is the tricky one. It is true.
Oh,
Yes.
if you have a high deductible health plan and an HSA that goes with it.
Why is that?
So if you have any form of coverage outside of your HSA, you are not able to make contributions to that HSA, nor can your employer. So that's governed by the IRS, so it's just something that's set in stone, which is a pretty tricky situation for a lot of people who are looking at retiring and moving to Medicare.
So the issue there is the HSA.
Yes.
Right?
Yep.
Okay.
Okay.
Got it.
Here's a tricky one. Are you ready? If you'd like to learn more about Medicare, your specific enrollment periods, your options in retirement, then you should join Luke at one of his Road to Medicare conversations.
Very true.
True.
And it's also true that there's free coffee and free snacks at these events. I try to make it a little bit more lighthearted than just cut and paste information. I try to get everybody involved and talking because, that's what we're all about. It's about community, and I really like informing people of their options.
Well, I think that's what's cool about those Road to Medicare things is they are educational only. People can come and just really sort of learn things.
Right.
What do you think most people are so confused about? Obviously, you're always kind of laying out these question and answers, but I'm sure you get the same ones over and over.
Yeah, I mean, the biggest ones are about penalties, if somebody's going to incur a penalty, if they should join, when they should join. So, I mean, everything that we have, it's very laid out in that format where it's like, this is Medicare A, B, C, and D.
Yeah.
These are your options when you retire, and then these are the next steps on how to get to your Medicare, how to get to your Medicare coverage, and enjoy your retirement.
That makes it so much easier.
I think so
This is
too.
confusing.
And having a consultation is so important. And I know along with these great classes that you do, you'll also go and meet with people. You'll meet them at a coffee shop. You're willing to go to their home, which makes it very convenient, as well as the locations that you have. We put together a map so that people can
Yeah.
see. And I know you like people to register for these. So the road to Medicare, you've got 3 locations here that we're going to talk about. First, to register, the phone number is 262-358-8734. So in Grafton, it's on Valentine's Day, Friday, February 14th. In Brookfield, then Monday, March 17th. And then in Racine, Friday, February 21st. And again, I know you want
Those are
people
all
to
February.
register.
Yeah,
Those
if
are all.
they could, that'd be great.
Oh, I'm sorry. It was Monday, February something. Man, and I even have my glasses on.
Just know they're all February. There
Yeah,
you
they're
go.
all in February.
14th, 17th, and 21st.
And then if you want to contact Luke for a one-on-one consultation, here's the phone number again. It's 262-358-8734. glmedicaresolutions.com is the website to
You're gonna
visit
make it
too.
easy for people.
Hopefully.
Thanks, Luke.
Thank you so much.
Thank you.
Appreciate your time.
Appreciate it.